Neutrophilic Eccrine Hidradenitis is the topic of discussion in this video. Hello everyone, myself Dr. Maddineni Srinivas, Dermatologist from Bharat. Let us begin the discussion without any further delay. So this was a 5 marks question asked in the DNB examination paper 2. Simply neutrophilic eccrine hidradenitis was given as a question. You need to write down under the following headings to get the appropriate marks. So this is also referred to as chemotherapy associated eccrine hidradenitis, or it's also referred to as idiopathic palmoplantar hidradenitis. By definition, this is a very uncommon self-limiting reactive skin condition where the neutrophils are going to be the predominant cells if you do a biopsy. We are going to see the histopathological findings also, and yes, like I have told you, this is characterized by dense neutrophilic infiltrate targeting especially the eccrine glands, which is going to also accompany the necrosis of the eccrine secretory coils and also the ductal structures. It is classified under non-infectious neutrophilic dermatosis, specifically within the subgroup of neutrophilic disorders affecting the subcutaneous and the appendageal tissues. Right, and this category also includes neutrophilic sebaceous hidradenitis and neutrophilic paniculatus. So this is the classification of the neutrophilic dermatosis, especially the non-infectious category. And if you look in this, you can clearly see that under the dermal neutrophilic infiltration, we have this neutrophilic eccrine hidradenitis. The rest of the other conditions we can discuss it in another video of neutrophilic dermatosis, especially the non-infectious causes, right? So historically, it was first described in the patients who are having AML and they were undergoing chemotherapy. So etiology wise, neutrophilic eccrine hidradenitis is classically associated with specific chemotherapeutic agents and also certain malignancies, especially the blood malignancies. But it can occasionally arise in non-malignant settings or even as an idiopathic variant, but this is not very common. So here you can see in this table the etiology and also associated triggers. Primary malignancy, especially the AML, is very important. Obviously ALL, other blood malignancies like Hodgkin's and also non-Hodgkin's lymphomas could also be associated. Usually occurs within 1 to 2 weeks following initiation of the chemotherapy in these patients. And what are the associated drugs? What are the chemotherapeutic agents? Yes, Cytarabine, anthracyclines, doxorubicin, daunorubicin, alkylating agents like cyclophosphamide, and granulocyte colony stimulating factor. So among this, Cytarabine is important for you to remember. And also we have told that non-malignant or some other triggers could be there other than the medications and the malignancies. So like for example, HIV infection, Pseudomonas infection, and also idiopathic recurrent palmoplantar hidradenitis. So these are the other triggers for the neutrophilic eccrine hidradenitis. And coming to the pathogenesis, the exact pathogenesis is not known, but the two primary mechanisms which are proposed are, the first one is the direct eccrine cytotoxicity because of the chemotherapeutic agent cytarabine, which is concentrated and also actively excreted in the sweat. Because of this, there is going to be accumulation of this cytarabine, which is going to produce necrosis of the eccrine epithelial cells. And also we can see that there is going to be associated necrosis of the epithelial cells, and also the necrotic cellular debris even triggers secondary sterile neutrophilic inflammatory response. So this is important. So because of this necrosis, there is going to be the attraction, or we can say the inflammatory response with neutrophils at this site wherever there is necrosis. The other mechanism which is proposed is hypersensitivity reaction. So there is a drug induced hypersensitivity reaction because of which the eccrine apparatus is going to act as a target antigen, leading to the localized recruitment of the neutrophils. So ultimately, whatever may be the cause, the medication producing the necrosis leading to the infiltration of neutrophils or the hypersensitivity reaction to the drug itself, ultimately there is going to be neutrophilic infiltration, right? This condition typically manifests during a state of profound drug-induced bone marrow suppression. So what are the clinical features? Primary lesions will be red tender plaques, nodules, papules and pustular lesions. And the lesions can also present as edematous, hemorrhagic, purpuric or cellulitis-like lesions. So this is very important since the patient is can present with cellulitis-like lesions. There is a possibility that it can be wrongly diagnosed, misdiagnosed as cellulitis, and the patient may be given antibiotics. But because this condition is not infectious, there will not be any benefit of giving the antibiotics. So we will see that in the differential diagnosis part. Okay, right. So the condition often mimics the cellulitis, leading to unnecessary prolonged antibiotic therapy, right? And this is the clinical picture of the neutrophilic eccrine hidradenitis, which may be mistaken for the sweet syndrome. So that's why the background of the malignancy and the chemotherapy are very important in the history, right? And the patient may also have the erythematous plaques present on the dorsal hand and also over the legs. Extremities can be usually affected. So anatomical distribution, it could be symmetrical or asymmetrical involvement, and especially lesions can be seen on the trunk, face, neck and also the extremities. Face and the neck involvement is common and causes significant facial edema in the patients. The associated symptoms, the patients can also have high fever, malaise and profound neutropenia resulting from the bone marrow suppression due to the chemotherapeutic agent. So this is very interesting because in the skin there is neutrophilic infiltration, whereas in the blood there could be neutropenia, right, in the same patient. So diagnostic histopathological features. So definitely we have to take a biopsy to confirm the diagnosis. And especially it is important to rule out any possible infectious etiologies, or probably because the patient is having malignancy, so we should also rule out any leukemic cell infiltration, that is leukemia cutis. So we need to do a biopsy, and if it is specifically neutrophilic eccrine hidradenitis, the biopsy findings in the eccrine glands would be dense neutrophilic infiltrate around and within the secretory coils and the ducts. And there will also be cell necrosis, vacuolar degeneration of the eccrine secretory cells and the ducts. And also we can see the edema in the dermis, especially in the papillary dermis, and also mucin deposition. So these are the important histopathological features which you need to remember. And so this is how the picture can look like. The neutrophils surrounding and infiltrating the eccrine glands and the coils. There can also be degenerative changes of the primary secretory cells. And this basically confirms the diagnosis of the neutrophilic appendiceal dermatosis. Eccrine degeneration. So vacuolar degeneration and coagulative necrosis of the eccrine secretory coils, and this is a very important differentiator from sweet syndrome, where the eccrine coils are structurally preserved. So sweet syndrome, it is acute febrile neutrophilic dermatosis. So we will discuss that in a different video. Coming to the dermal changes, there will be dermal edema and also mucin deposition, right? And also there could be extravasated erythrocytes. And these changes reflect the localized vascular damage and extracellular matrix remodeling in these patients. So remember this neutropenic paradox. In patients who are having this chemotherapy-induced neutropenia, which is profound, the neutrophilic infiltrate surrounding the eccrine glands may be strikingly mild or completely absent. So this is one very important finding. In this non-infectious neutrophilic dermatosis, the skin may show a very mild or even completely absent neutrophilic infiltrate. So that's why it is called as neutropenic paradox, right? So this is very important exam point which you have to remember. In the neutropenic patient, the presence of isolated eccrine gland necrosis with minimal inflammation is still diagnostic of neutrophilic eccrine hidradenitis. Definitely we should correlate this with the clinical features. So what are all the important differential diagnosis you have to remember? So we have discussed already some of the names, sweet syndrome, and we have already seen what is important differentiating point. No necrosis is seen in the eccrine glands in sweet syndrome. Leukemia cutis, obviously there will be atypical neoplastic myeloid cells deposition, right? And also infectious cellulitis, ecthyma gangrenosum, there will be bacteria, tissue necrosis and thrombi. So we should also do the gram stain tissue culture and blood cultures if you strongly suspect the cellulitis, right? And eccrine squamous syringometaplasia, this will lack the neutrophilic infiltrate, and also necrosis, which is characteristic of neutrophilic eccrine hidradenitis. Coming to the management and the prognosis, this condition, like initially told, it is a self-limiting condition. It is a benign self-limiting condition, spontaneously resolves within 1 to 2 weeks as the chemotherapeutic drugs are cleared and the patient recovers from the neutropenia. So as a part of the active medical therapy, we can give the NSAIDs like indomethacin to provide relief from the pain and the fever. In moderate to severe cases, we can also think of the prednisolone. And remember, dapsone is a medication which is used whenever there is neutrophilic chemotaxis. So here also we can use this. Chemotherapy management. The development of the neutrophilic eccrine hidradenitis does not mandate the permanent discontinuation of the chemotherapy. The oncologist can safely continue the treatment protocol, but the thing is that patient and the clinician should be prepared. We should be ready for the potential recurrence upon the drug rechallenge. So these are the important points related to neutrophilic eccrine hidradenitis. I hope this video is helpful. If so, please do that like button and also do comment. Thank you, sir, if this video is really helpful. And also do hype this video if the hype option is there. And if you're not yet subscribed, what are you waiting for? Subscribe to my channel. We'll meet again in the next video soon. Thank you so much. Bye-bye. Happy learning. Till then.